Welcome back. If you're a drinker, we hate to be the ones to break some sobering news to you, but a major new study says no amount of alcohol is good for your overall health, not even that cheeky glass of red wine you might be holding as we speak on a Friday evening. A survey in the Lancet Medical Journal says the overall risk of liquor outweighs any known benefits. It says alcohol accounted for nearly 1 in 10 deaths in people between the ages of 15 and 49. That data was recorded in 2016. Across all age groups, alcohol was associated with 2.8 million deaths that year. This is, of course, big news for drinkers, but does it really mean that the glass is half empty? To get to the bottom of that glass, let's speak to Dr. Richard Harding, a former government advisor and chairman of the group Drinkers' Voice. Thank you very much for being with us. So I'd like to hear, first of all, your thoughts on this study that alcohol isn't good for you in any amount whatsoever.
Well, what this study concludes is that there's no benefit to alcohol consumption at any level of consumption. Globally, taking a global approach in the way it is consumed today. That's the conclusion it reaches. What would be a mistake, I think, is to draw any conclusion about the relevance of this to giving advice to any consumers in any individual country. And there are a number of reasons for this. The data source is absolutely huge. It's 694 data sources from 195 countries. And they fed the data into a mathematical model and came up with this conclusion. Well, if you do that, you're going to get an answer which is not relevant to any particular place, any particular country. Alcohol consumption is highest in countries which had the greatest life expectancy, and it's lowest in the lowest life expectancy. There's lots of different factors which influence the health outcome.
And there are lots of different factors, and as you argue, it is a comprehensive study extending all around the world, but yet it isn't the only study that makes this argument. Even England's chief medical officer has said, Dame Sally Davis, I believe, that every time she looks at a glass of wine, she asks herself, well, do I want to increase my risk of breast cancer? And that alcohol is, in fact, not good for you. So why is there so much disagreement within the medical community? For example, in contrast to something like cigarettes, where people have a fairly cut and dry idea of the fact that it's always detrimental to health. Why is there so much dispute when it comes to alcohol?
Well, I mean, the UK guidelines were a result of a mathematical model as well. They used to model.
So what's wrong with mathematical models?
Well, the way public health advice is normally formulated is you take observational studies on the effect of different lifestyle characteristics on the outcome of mortality or disease. So you're looking for characteristics where people live the longest or have the lowest prevalence of disease. That's why we're encouraged to exercise regularly, not to smoke, have a healthy diet, eat lots of fruits and vegetables. If you carry out the same exercise with alcohol in Western countries, European countries and UK and the States, you can draw upon an enormous number of studies dating back nearly 50 years, which are highly consistent, which show a J-shaped relationship between disease outcome and consumption. And you get, with moderate regular consumption of alcohol, you see a drop in risk for coronary heart disease, for ischemic stroke, for diabetes. In the last 20 years, you've seen evidence for a protective effect for moderate consumption, for dementia and Alzheimer's disease.
Okay,
and that even survives when you come to the all-cause mortality, which is death from all causes.
Yes, and so that would be according to some studies. And does it matter, though, what type of alcohol people drink? So our viewers who might be having a glass of wine now, is there a distinction to be made between whether or not you enjoy a glass of wine, which I understand has resveratrol and other beneficial compounds, versus a sugary drink or a heavy spirit? Does it matter what you drink?
In terms of the cardiovascular benefit, it's certainly the alcohol that's doing the job. There might be additional benefit in the antioxidants in wine, as you say. Equally important to the quantity you drink is a pattern of drinking. And it's incredibly important not to get intoxicated and not to binge drink. But this body of evidence over this long period of time has clearly shown that people in Western society who drink moderately and regularly tend to have longer and healthier lives than either heavy drinkers or abstainers.
Right.
And that message is lost here. But the other thing in this study which they've done, which they really shouldn't do, is they've mixed together acute and chronic harms. Now, acute harm is when somebody drinks alcohol, their judgment is impaired, they have an accident, drinking and driving, fall off ladder or whatever it is.
Yes.
And chronic harm is the effect of alcohol consumption on chronic disease over the long period.
And there certainly are...
And they've mixed them up.
Well, there are question marks about the methodology, certainly, but I appreciate you giving us the alternate perspective, and also clearly there's areas where you do agree. For example, intoxication or binge drinking is definitely wrong in the study, and you would also agree with that. So
absolutely.
Thank you for joining us. Thanks,
Thank you.
Dr. Harding.